Hello there. Come on in and have a seat. Yes, I'm Dr. Familiar. What brings you to our office today? Okay, you're a new patient. Alright, let me just look up some of your information in the system. The nurses asked you some questions. Yeah, okay. So what's your name? Okay, and your date of birth? Alright, so the only thing they did so far was take your insurance information. Okay. So first I have some paperwork here we're going to fill out together. Alright. Yeah, just some routine questions so I can get an idea of your medical history and all that. And so let me fill out today's date and your name. And what would you like me to call you? Do you have a nickname or anything? Okay. And are you married? No. Okay. And what is the best way to contact you with test results? Okay. Phone. And what is that number? Okay. And in case of an emergency, who should we contact? Okay. Your mother, and what is her phone number? Okay, and she is your mother. And what is her full first and last name? Okay. And do you have any allergies? No? Okay. Have you ever had a reaction to any kind of drug, including a vaccination? No? Okay. And your main reason for making the appointment? Okay, you moved into the area, okay. So how long have you been here? Yeah. Okay, do you have any current medical conditions? Okay. Just asthma? Anything else? Allergies? Yeah, like pollen, pet dander. Yeah, asthma sometimes goes hand in hand with those. Okay. Do you find your asthma is worse when your allergies are acting up? Yes. Okay. Okay. Do you have any other doctors that are currently treating you? No. And what was your previous doctor's name? Okay. And where were they located? Okay. Yeah, then we can contact them and get your past medical records. That can be pretty useful. So have you ever had any hospitalizations? Okay. And that was for your asthma? Okay. And any other major illnesses? No, okay. And any surgeries? Okay, just tonsils removed. How old were you? Okay. Alright. here. And what medications are you taking? Okay, just the albuterol. And that was prescribed by your previous doctor. Okay. And the dosage. Okay. How often do you have to take it? Okay. Once a week. Do you need refills on that? Yeah, okay. Yeah, we can do that for you. What is your preferred pharmacy? Yeah, there is a CVS and a Walgreens in town pretty close. Okay. And, do you take a steroid inhaler, like Advair? Yeah, okay. And same doctor? And dosage? Okay. And you take that twice a day? Okay. Take that for your asthma. And do you need refills? Yes. Okay. Do you take anything for your allergies? Okay, only during allergy season, but not right now. Okay. And, anything else? Do you take anything over the counter? No. Okay. Let's get our next. Having trouble getting my papers here. Now these ones are going to be more lifestyle questions, just so I can get an idea about your health and everything. So, who lives with you in your home? Spouse, children? Oh, you said you weren't married. Do you have a partner that lives with you? No partner. Okay. Any children? Parents or anything else? No. Okay. So you live alone. Do you have any pets? A dog. Okay. And what is your occupation? Okay. Ooh, I bet that's pretty fun. And do you have any hobbies? Okay. And how often do you do that? Yeah, we have some really good disc golf courses around here. That's pretty good exercise too, and get you outside. And where were you born? Okay. And what formal education have you completed? Okay. Some college. All right. Have you ever traveled outside the United States? No, okay. And you said you disc golf, but do you get any other regular exercise? Okay, so disc golf and dog walking, both great forms of exercise. Do you wear a seatbelt? Okay, always? Alright. Have you ever smoked, or do you currently smoke? Okay, never smoked. How about drinking? Okay, and what type of alcohol? And how many times per week? Have you ever had a problem with drinking? No, okay. How many cups of coffee or caffeinated drinks do you drink daily? Okay, just one coffee? Like a basic coffee cup size? Okay. Do you use any marijuana? No? Okay. What about cocaine or any other street drugs or prescription drugs that are not prescribed to you? No? Okay. And so, family history. How old is your mother? Okay. And does she have any health problems? Okay. And how long ago was that? Okay. And your father? Okay. And does he have any health problems? Okay. What about brothers and sisters? Only child, okay. And do you have any children? No, no children, okay. Now we're just going to run through these. For your past medical history, you can just tell me yes or no, okay? Hypertension, diabetes, cancer, heart murmur, heart problems, and you have asthma, okay? Emphysema or COPD, positive skin test for anything? No? Okay. Tuberculosis, blood clots, asbestos exposure. That would be like if you lived in an older house where you were around. No? Okay. Ulcers, colon polyps, gallbladder problems, hepatitis or jaundice, liver problems, pancreatitis, kidney problems, seizure, depression or anxiety. Yes, okay. Stroke, blood problems, thyroid problems, arthritis, any radiation treatments, previous STD infections. No, okay. HIV. No. Any other things? No, okay. And let's see, have you kept up to date on your shots? Okay, so you've received all your childhood shots. Okay, and when was your last tetanus shot? Okay, 4 years ago, so you still have a little ways to go. Okay, so none of this really applies. So we'll do the next one. I know it is a lot of questions, but it really helps me to have a thorough idea of what's going on. So now I'm just going to ask you if you've had any of these symptoms recently, and you can just say yes or no, okay? Alright. Fatigue, fever or chills, recent weight change, headaches, vision problems, double vision, blurred vision, eye itching, eye pain, hearing loss, earache, ringing in the ears, runny nose, nosebleeds, nasal congestion, okay, snoring, hoarseness, sore throat, mouth sores, any breast lump or pain? No, okay. And chest pain, a regular heartbeat or pounding heartbeat that you've noticed? Okay, shortness of breath. Is that from your asthma? Okay. And cough. Is that also associated with asthma attacks? Okay. Wheezing. Yeah, occasionally. Also asthma. Okay. Decreased appetite. Increased appetite. Difficulty swallowing. Heartburn. Nausea. Vomiting. Abdominal pain. Any problems with stools? No. Okay. Are you getting up at night to urinate? No. Okay. Excessive thirst. Weakness. Easy bruising. Muscle aches. Joint pain. Joint stiffness. Swelling in arms or legs. Dizziness. Fainting. Memory problems. Numbness. Anxiety. Okay. Depression. Trouble sleeping. Hallucinations. Dry skin. Itching. Any lumps or spots that you've noticed on your skin? Okay, yeah, we can look at that when I do the exam in a minute. Rash. Okay, and any extra stress or anything in your life? Yeah, just from moving. Yeah, that can be pretty stressful. And you're not geriatric, so we don't need to do that one. And I'll just have the mental health questionnaire. Okay. Just like to do this since you said you suffer from anxiety and depression. So, over the past 2 weeks, how often have you been bothered by any of the following problems? There is not at all, several days, or more than half the days. Okay. Little interest or pleasure in doing things. Okay. Feeling down, depressed, or hopeless. Okay. Trouble falling asleep, staying asleep, or sleeping too much. Feeling tired or having little energy. Poor appetite or overeating. Okay. Feeling bad about yourself or that you're a failure or have let yourself or your family down. Okay. And trouble concentrating on things such as reading or watching television. Okay. So you did score a 4, which would be a good idea. We can set you up with, we have therapists here, and we can set you up with them if you would like. Okay, yeah, they also have a psychiatrist on staff. Yeah, they can prescribe you any medications if you would like. I can write up here that you would like to make an appointment, and then they'll make you 2 separate appointments, one with the psychiatrist and then one with the therapist. Okay, great. So I'll help you get set up with those before you leave today. Okay. Alright, so I'm just going to enter some of this information into my computer real quick, and and then the nurses can go and get those appointments for you while we're doing the exam. Okay. Is there any specific time or days that work best for you? I sent that out to the nurses, and then they'll make the appointments for you. Okay, great. So now we can get to the examination. Okay, so the first thing that I'm going to do is take a listen to your heart. If you can take a deep breath for me. Okay. And another. Okay. And I'm going to put this on your back. Okay. If you can take just several deep breaths. Okay. And if you can breathe normally. Okay. I do hear some of the congestion in there from the asthma. Yeah. Does it ever bother you? No? Okay. We can set you up with a specialist as well, and they might be able to help you sort out your medications and make that a little better, so you're not having to use a rescue inhaler once a week. Okay, let me write out to my nurses again, and we'll have them set you up with that. The same time and days. Okay. Okay, that way they can get you set up with that. It still sounds like you're having some issues even on the medications, so we've just got a couple more things we're going to use to look at you here. Let's start off with blood pressure. Everybody's favorite one. Just roll up your sleeve a little. So that looks pretty good. Let me write that down. Yes, pretty average. Okay. And now we're going to do a skin check. Where was that spot you wanted me to look at? Okay, over here on your arm. push on it or anything. Okay. So that just looks like a skin tag. Yeah, we can remove that in the office. Yeah, it's simple. Okay. And let's see. Just going to kind of look down your arms. Your other arm here. Okay. Do you ever have any swelling or anything in your calves or your feet? No? Okay. Alright. All looks pretty good. Do you mind if I look at your back? Just go around you here. I'm just going to lift up your shirt and look at your back. So it all looks pretty normal to me. I don't see anything that I would be concerned about. Now I'm going to press along your face and your neck. Okay. Does any of this hurt? No. Okay. How about over here? No? Okay. Just let me know if any of this causes you any kind of discomfort. Okay. Alright, and in the throat. Okay. Alright, again, that all feels pretty good. I would like to have a look in your ears. Just get right up here. Let's see. Okay, looks pretty good on that side. Let's go over here. Okay. Both look pretty good. Now we're going to check your eyes with my little flashlight. It is pretty bright, but it will only be uncomfortable for just a minute. Okay, so I'm going to turn it on, and then I want you to follow the light, okay, the best you can. Pretty good. Now if you can just look straight at me, just straight forward. Okay, great. Okay. That all looked pretty good. Now I'm going to use this to look inside your mouth, your teeth. Okay, yep, go ahead and open up. Here we go. Okay. Alright, it looks pretty good in there. Looks like you brushed pretty well. I would also like to take your temperature. Okay, so you can just open up your mouth for me. Okay, great. And we'll just hold it there for a second. Okay. Alright. 97.5. Very normal. Now I want you to hold my hand, okay, and squeeze it. Okay, now place your hand on top. Okay, yeah, both hands. Okay, I'm going to push up. I want you to try to stop me. Okay, and now I'm going to push down and stop me. Okay, great. Okay, now I would like to do scalp check. Just like we did the skin check. I'll just look a little. Okay. I don't really see anything. It looks pretty healthy. And the last thing is going to be palpating your stomach. Yeah, if you can just sit up. I'll just look here. Okay, just let me know if any of this is uncomfortable for you. Okay. Okay, no pressure or anything here. Just look back over and make sure we have everything. Do you have any other questions or concerns that weren't addressed today? No? Okay. Did you want to make an appointment to get the skin tag removed? Yes, okay. Same time, day. Okay. Yeah, that's actually an appointment I can book for you right now. Okay. So it looks like they were able to book all your other appointments. They were able to get the psychiatrist and therapist appointment back to back. So that will be Thursday at 3:30. Okay, and then you'll have a half an hour with the psychiatrist and then an hour with the therapist after that. Yes, and then after that you only have to see the psychiatrist, I think, once every 3 months, as long as you're not having any issues. Okay. Yeah. And then the therapist will decide how often to see you after that. Okay. And the appointment for the asthma, that's going to be at the hospital. You just check in right at the front desk, and you give them your name and they'll tell you where to go. And that will be Tuesday next Tuesday at 4:30? Okay, let me just confirm those appointments for you. And the it looks like we have an opening today at 5 if you want to do the removal then. Yes, okay. Would you like to schedule your yearly checkup today? Yes? Okay, same date, time? Actually, looks like we have the exact same day, time today, just next year. Okay, perfect. And why don't I get a card and I'll write down all these appointments for you. Yeah, okay. It's a lot to remember. Okay, there you go. Alright, thank you so much for coming in today. Yes, I hope you have a really great rest of the day. Yeah, thank you.